Hello, my name is Dr. Dima El-Sharkawi and I'm a haematology consultant at the Royal Marsden Private Care. So I love haematology and I want to share some of my interest in haematology with you all, and I want to explain to you a bit about blood cancers and what I think you need to know as primary care physicians and GPs. So on the screen now, you have what the haematologists consider as the tree of life. This is how all your blood cells develop in your bone marrow. So you start off with stem cells that have the ability to replicate and divide, and then also differentiate. And when they differentiate, they would either go down the myeloid route and eventually become your red blood cells, your platelets, or your white blood cells that have granules in them, the granulocytes. So they're the neutrophils, the eosinophils, the basophils. So that's down the myeloid route. Or they go down the lymphoid route and differentiate into B lymphocytes or T lymphocytes. And some of the B lymphocytes can then become plasma cells, which are the cells that produce antibodies. So any one of these cells can become malignant, and the way that we define our blood cancers is by which of these cells have become the malignant cell that are proliferating. So if you've got very early cells that have become malignant, then they are the leukemias, and like our normal cells can become myeloid or lymphoid, you can get acute myeloid leukemia or acute lymphoid leukemia. And then as the cells become more mature, on the myeloid side, the malignancies become the myeloproliferative disorders, so an excess of red blood cells because of a problem in the bone marrow itself is polycythemia rubra vera. If you've got an excess of granulocytes, again, primarily because of bone marrow dysfunction and disorder, then these are the chronic myeloid leukemias, the chronic eosinophilic leukemias or chronic basophilic leukemias. Of course, some of those are very rare. And then a primary hematological cause of raised platelets is essential thrombocythemia. So these all group together on the myeloproliferative disorders. Now the myeloid cells can also, particularly as all our bone marrows age, as we age, can sometimes not function properly, and patients can start to get low blood counts as opposed to proliferation and high blood counts. And when the myeloid cells aren't being produced in the proper way, then this group of diseases is coined myelodysplasia. And then the third thing that is considered part of the myeloid disorders is myelofibrosis, where you get fibrotic change replacing the marrow and preventing a patient producing their normal blood cells. So again, can present with low blood counts, but an enlarged spleen as the fibrosis occurs in the spleen as well. So that's on the myeloid route. On the lymphoid side, as the cells become more mature, patients can potentially develop conditions such as chronic lymphoid leukemia, but also the lymphomas. And like you've got B lymphocytes and T lymphocytes, you can get B lymphomas and T cell lymphomas. And then malignancy of the plasma cells is myeloma. So essentially, if you understand how your cells are produced in your bone marrow, you essentially understand how blood cancers are categorized at this moment in time. Thank you very much for watching.